Good evening, students. This is Miss Lamport. I was going to show you some important items about some of the blood work that we're going to do. We talked about it today in our Zoom meeting that we were going to talk about doing capillary sticks. And capillary sticks are done on these two fingers only. Can't do this finger, can't do this finger, and can't do this finger. And there's reasons for not using all these fingers. This is too close to a bone. This one is, it's used too much, so it's callous, and you never do it on your thumb. So you really only have your ring and your great finger to stick, but you can stick on both sides, lateral sides of your fingers. And what I need you to notice, the correct positioning of where you're supposed to be sticking is right here next to the nail, but not right into the nail bed. And you want to stick it in the fleshy part that's right here. Never want to stick it here in the middle, because it'll bleed and go right down in your nail, and you won't be able to collect the items that you need to collect. So we want to make sure that we do it on the lateral aspects of your great finger and your ring finger only. Okay? So I'm going to talk about why do we do capillary sticks. Capillary sticks are done for small amounts of blood, and a lot of times they're used for children to test do their blood test because it requires such a small amount of blood. Okay? So what we need is our pair of gloves. Always have to have a pair of gloves. You need the clay, and I'm going to show you what this clay is used for when I do the microhematocrit collection. And then of course we need a lancet. A lancet is like a device that does the puncturing of your finger. Right? You have to have a lancet. You're going to need a gauze. I always use gauze, not cotton on blood draws, because the cotton sticks to the blood area. Then of course you need your alcohol preps. Your alcohol preps are always used to prepare the site before you do any kind of procedure. You're going to need, I always suggest that you get 3 of these microhematocrit tubes, and they are made out of glass, so you have to be very careful with them. They're fragile, and they will actually break if you're not careful with them. Okay, so they look like this, and they are breakable. So when you're going to put them in the clay in a minute when I show you, be very careful, because if you're not careful, you'll crush these or break these, and then you're exposed to that person's blood and body fluid, and it can also cut you as well. All right, so you have your microhematocrit tubes or your capillary tubes, and I say get 3 of them because we actually need to have 2 good ones, and sometimes we're not successful to getting the 2 good ones, so we need a 3rd one just to make sure that out of these we get 2 that we can successfully spin in a centrifuge. Okay, so I always say at least get 3. If your first 2 are good and you only have to fill up 2, then you don't need that 3rd one. You can always replace it and put it back for use next time. Okay, and then also today would like to also show you another use of a capillary stick, and that is your glucometer. Your glucometer is a machine that diabetics use to measure their sugar level, or we call it sugar level. It's really glucose level. So they do this however many times a day that the doctor has recommended. Now there are new ways that they can do, it's called a freestyle, that they actually put a device on the back of their arm and they don't have to stick themselves in the finger anymore. But if you can't afford the freestyle, or maybe your insurance doesn't cover it, you can always do the finger stick and do capillaries for glucose. I want to go ahead and show you how the glucometer works before we get started. And if you notice that it has a little button here, and then it has your little field right here that's going to have your numbers on it. You don't have to push any buttons to start this, but this is an actual glucometer strip that goes with it. And if you can get close in here and see, there's 2 little gold bars in here, and then if you look on the back of your strip, you see those same 2 little gold bars. So you're going to take it with this little purple piece sitting up like that, and you're just going to put it down in there. And when you notice, when I did that, it actually turned my machine on, and it's telling me that now I need to put a drop of blood on it. So it's actually ready for us to do the glucometer testing. Okay? The normal range for a person that are having doing glucometer testing, especially for somebody who is not a diabetic, there should be 70 to 110 fasting. What does fasting mean? That means we haven't had anything to eat. We may have had some water, but we haven't had anything to drink or eat other than water for the last 10 to 12 hours, okay? So these a lot of times want to be done fasting so that the food doesn't interfere with your level. Because if you get up in the morning, you drink a big old cup of coffee with all that wonderful creamer, all that creamer that's all full of sugar, and then you add some sugar, well, your glucose level is going to be sky high. So you want to make sure to get an accurate reading that you're fasting before you take your glucose levels. And then also, sometimes like in the hospital, they take your glucose before they give you, check your glucose before they give you your meals, because if your glucose is too high, they want to give you a shot of insulin to bring your glucose level down before they give you your food, okay? This device right here is a lancet, again, like I said, and this little cap is going to come off, and then you're going to press it right to their skin, and you're going to push hard. If you don't push hard enough, you won't penetrate them well enough, and you won't get enough blood. Now I will say, and I'm going to be honest with you, it's not a pleasant experience to be stuck in the finger with this lancet, but we have to get the blood in order to do these tests. I am personally going to be sticking my own finger, basically so that you can actually see the actual way it would go. And of course, in this case, I can only put on one glove because I have to have this finger free. But you would never really stick yourself unless you are doing your own blood sugar level at home. And if that's the case, then you do have to stick yourself. Okay? So what you're going to do is find out which finger that you're going to use, and you want to always take and wipe it in a circular motion all around, and then dispose of your alcohol prep. And you want to let this dry. Do not go like this and fan it. Do not blow on it, foo, and do not take a gauze pad and wipe it. The whole point of us putting that alcohol in there is to remove all the bacteria and the items from our area. And if we take something that has bacteria and wipe, or we blow the air, we're just going to contaminate our site again. Okay? So in order to use the lancet, you have to pull this little cap off. Now this little cap does not go in your sharps container because it is not sharp. The actual needle that's inside of here, as soon as I use it, I will drop it in my sharps container that I'm using as a sharps container. Okay, so I've cleaned my area, and then I'm going to take this and I'm going to put it right here, and I'm going to push this hard onto my finger. Okay, and I drop that in there immediately. And then now one of the things that we have to do in this case is we have to wipe away the first drop of blood. So I'm going to wipe that away because that has tissue fluid, and we don't want to get the tissue fluid in. I'm going to go ahead and do my glucose level first. Okay, and it's got the little thing on there again telling me that I need a drop. So I'm going to squeeze up like this and get a nice size drop, and I'm going to place this little pointed part of this on here against that and just lay it right in there, and it's going to suck that blood up in there, and then it's going to start doing a countdown for the actual testing. Now I want to get a good drop, and I'm going to take my microhematocrit tube, and I'm going to keep it level. You must keep it like this. And so watch, it's really kind of looks like a magical trick because I'm not doing anything, and it would just, by capillary action, it would just pull that blood up in there. So keep it level, and then I'm going to get another sample of blood. You want to get a good sample of your blood, and then I'm going to put it on there again, and it just magically, again, by capillary action, pulls that blood right into the capillary tube, okay? And you continue to do this. You want to get this tube filled up at least 2/3 to 3/4 full, and you want to be sure that you do not get any air bubbles in it. That's why I'm keeping it perfectly level. If I let it down a little bit, I'll get an air bubble, and I don't want to get an air bubble in because the air bubble then is replacing the blood, and it will not give me an accurate reading, okay? See, I let it get a little air bubble because I actually let it go down a little bit. So we'll tap it just a little bit, and then we can go ahead and continue to finish filling up our capillary tube. Okay? Now when you are doing this, you want to gently milk it up, and then when you get to the top, you want to do it a little bit harder, and that way it will keep enough blood supply for you. Okay? All right. So we've got it almost to over the line. So what I want to do now is I would give my patient the gauze to hold on their finger, and I want to just get any blood off of this, and I'm going to then get my clay, keeping my finger over the top, because if I take my finger off the top of this, all that blood is just going to flow out, and I'm not going to be able to use it. So you want to keep your finger on the top, and you want to gently bring it down into this clay, stick it in there, and then turn it until it seals. And when I pull it out, you're going to see how the clay has sealed the end of my microhematocrit tube. And now, when we're ready to spin it, we can put it in a centrifuge and spin it. And then when you spin them, you spin 2 in the centrifuge, because you want to take the actual average of something, and the only way you could take an average of something is to have 2 added together and divide it by 2. So we would get an average, okay? And you would do at least 2 more of these, and you'd put it in the centrifuge, and then you'd wait for it to stop the centrifuge going around. It goes over thousands of revolutions per minute, and then when it stops, you'd take it out and you'd use the reader to find out exactly what that person's levels are. Okay? I don't actually have a reader today, or the centrifuge, but you have the tubes ready and they go directly into the centrifuge. Okay? So that is how to do your glucose testing. Oh, and by the way, it came up with a number, and I don't know if I can bring it back up or not. 117 milligrams per deciliter. So when I write this result, I put mg/dl. And when I write this one, I'm going to put a percentage on this, because this is by a percentage. So this one is mg, which is milligrams/deciliter, 117. And this one, when I spun the 2 of them and I measured them, they would give me a percentage such as 38%, 35%, something along that line. So that's just a little demonstration on how to do your collecting your microhematocrit tubes or your capillary tubes to spin them for a hematocrit test. What does a hematocrit test do? It tests for the percentage of packed red blood cells when we spin it in the centrifuge, and they fall. It separates your red blood cells from your liquid, which is the serum and plasma in your blood, and then you measure the packed red blood cells once it's spun, and that's how you get your hematocrit reading. Hematocrit readings are basically to indicate if a person, along with the hemoglobin, which I'll talk about later, it tells about if a person has iron deficiency anemia. Okay, so your glucometer is for testing for blood sugar, the person's blood sugar or the glucose in their blood if they're diabetic, and this one would test for their hematocrit to find out whether or not they have iron deficiency anemia. Okay, all right, well, thank you for paying attention, and I'll see you again later. Bye.